joint and the spine, okay? So you probably need to come a little bit behind. Okay. So before starting, you can work on the towel, yeah? So you can do a nice mobilization. So actually my hands are in between, the spine is fit into this groove. Do you see this groove? Uh-huh. Yeah? So the spinous processes fit into there, and then you really lean onto the spine, yeah? Especially around the kyphosis. The kyphosis is in the middle back, yeah? So you need to straighten that, yeah? Do that. Then you can feel the space between the lower ribs and the hip bone. It's a really nice place. You can go and work, massage, really nice, like a squeezing the sponge on the erector spinae and the quadratus lumbarum. Yeah, we have done this oscillation, so now we kind of ready for massage. Yes, so all you need to do is just really reflect that, and it's ready. Yeah, can I undo the bra? Mm-hmm. Yeah. Good. Any oil around?
Oil to the window. It's on the window ledge.
The window. Thank you. So start from here. Now, you see there is on side lying, one of the cons of side lying that the body can move too much. So you need to be sure that they don't become seasick with your movement, yeah? And one way is to hold one hand here and then massage to the other side, yeah? Yeah, maybe you can come from either around there, it will be easier. Okay, so hold it this way, yeah? And you need to use a lot of your knees, yeah? Your knee really bending you, yeah? Good. You can come from here, from above, and this would be a really nice and easy place to work around the erector spinae muscle. You can do it this way. However, do you see her hand? It's on my way, yeah? So I'm aware of it, and I might need to ask her to use it. Is it comfortable this way, yeah? So, because now I need to come closer. So instead of having my two legs closer to the table and just bending this way, I always prefer to have one leg backward and then come and even, do you see that the other leg is in the air a little bit? So I'm actually kind of seesaw on this hip, like that, yeah? And do like a nice pressure here. You can, the same thing as we did, move the spine itself. You can move the ribs. But when it comes to forward, then you need to use your judgment and cover. And then attaching the front of the ribs, yeah? Okay. Moving on to the lower back, you can come from here. You can use your knuckles nicely. When you come into contact the iliac crest, you can nice stretch, create a nice stretch. Even to enlarge the stretch, what you could do is to come and just drop the upper leg. You see why? Look what happened now if I just move that in here. You can do a nice oscillation this way. or stretching, which muscle do I stretch now?
Soleus.
Not much, because soleus to stretch, I will need to do that. So,
Hamstring?
nope.
The
Nope.
tibialis anterior.
Sorry? Not much?
Glutes.
Nope.
Give up.
What?
Where do you feel the stretch?
Where?
Yes? Sorry?
One of the top.
Tansi fascia late. And if I do it a little, yeah, here.
And where?
In the back. Do you see that? Do you see the back move?
Okay.
Yeah. So actually stretch that down. Yeah? So you can feel the stretch kind of here. Yeah. And tensor fascia late. So on the side. Yeah. Okay. To stretch soleus, you need to do that movement. To stretch the hamstring, you need to move it forward. Yeah, that's how you stretch the hamstring. To stretch the quads, you need to move it backward. To stretch the gluteus, you need to do kind of that movement. Remember?
Yes.
So yeah. So you're lifting it. You're lowering the leg. So then you can do a nice stretch into here. Then, do you remember what we did with remember what we've done with gluteal area? Yeah? So we work from greater trochanter above, we work on gluteus maximus, medius, and maybe a little bit of minimus here. And there is a small muscles that called tensor fascia late here as well. Yeah? Nice to work. You can bring your leg back. Yeah? Sorry. Thank you. Bring their leg back. And then, actually, that's the best way, I think, to work on the gluteal area because they're quite close to you. They're very comfortable. You can come right away into here. Nice stretch. Also, another one of a great technique is to work on the sacrum itself. Now, when you're thinking about the sacrum, you can think, okay, well, it's a bone. Why do you massaging the bone itself? But actually, it is a bone, but it covers with a lot of ligaments and tendons. When you think just about the tendons, think about gluteus muscles. They're coming and attached to the sacrum. Yeah? The erectus spinae come and attach to the sacrum. QL may come and attach to the sacrum. So the sacrum is actually filled with a lot of tendons and a bit of ligaments. And it appears that the differentiation between a tendon and a muscle is not very clear. So you have some muscles in the tendon as well. And you have, so that means that massaging the tendons on the sacrum itself may relieve some tension. So when you look at kind of anatomy book, you have the muscle that end up with the tendon. And the muscle has the muscle cells, and the tendon has no muscle cells, but it's not right. It's not correct. On the tendon you have, so it's nice to massage the tendons as well. And it will give a relief on back pain and also give some relief of tension as well in the lower back. So do work on the sacrum itself. Okay? Gluteal muscles, feel the sacrum here. I'm feeling the edge of the sacrum. So I'm on the muscle. This is the muscle and this is the sacrum, and they're coming together. So what I'm doing, I'm feeling the sacrum attached to the muscle. It's nice to work on the attachment. Okay, so you're right on there. Okay? It's the same with the greater trochanter. So greater trochanter is the bone, and you have muscle coming from here, like a fan. So just really work around this bone attachment, and you have a lot of muscle coming all the way to the greater trochanter.
Draw.
So it's nice even to do that technique, you know?
Is there any difference that we need to be aware of between the male sacrum and the female sacrum? Like on the body?
The female sacrum would be wider.
Right.
Male sacrum would be narrower and longer. But
Okay.
that's it.
Okay.
Then we need to change and work on the rest of the gluteal area. You can do that by working on both sides here. It's nice because here now you can work on the hamstring and quads and iliotibial band all on the same position. All you need to do is that. Yeah. And then on the iliotibial band, you can use your knuckles, you can use deep effleurage, yeah? However, I would like to show you how to work with skin to skin. So you're taking this. Thank you. And then what you do, you're taking the towel and putting it in between the legs, so you can lift this leg a little bit. Thank you. You're taking that a little bit off, and then lifting that, and you're creating a cradle around. So the top towel you're tucking under the, and then you can even ask the client to hold it. Yeah. Good. I want the camera to come around so you can see me coming from this position. And do you want me to show it again, or you're okay with it? With the, I guess you will have it on the video. So watch it again on the video, and then you have kind of not 360 degrees, but 270 degrees approach to the lower limb, starting with the gluteal area. Yeah. Again, greater trochanter, muscle coming from the sacrum all the way like a fan. Gluteus medius here, gluteus minimus, and they're all attached to here. So in a way, you can work both sides. And then you can continue by working on the direction of gluteus maximus all the way to the sacrum. Then iliotibial band. Iliotibial band usually would be tender. So work here. If you start working deeper, it usually will come the tenderness. Too much?
Yeah.
Okay, easing off. So if it's too much for that client, I can do two things. I can slow it down, or I can lighten it up. I prefer to work on the same pressure, actually slow it down. Okay. Hamstring, you can come from this direction and work on the hamstring. Quads, you can come from the front. especially here for runners, iliotibial band and vastus lateralis. Vastus lateralis is the lateral side of the quads. It will be very tight, very, very tight and very tender. So it's nice to work onto this area. Very easy for you, and you can do really good effect on their lower leg. Yeah? Okay. Which muscle I'm working now on? Tibialis anterior, good. And which movement it produced?
Plantarflex.
Dorsiflex. Dorsiflex. So this movement, and you can feel that. Can you do it again? Yes, you can feel that. This muscle might be quite tight on runners, especially at the beginning, or what I call the tourist muscle. When you walk with flip-flop at the beginning, and you kind of hold your toes hard, you know, or walking on sand, this muscle can be quite tight. Yeah? So, here, I think it's enough, isn't it? Yeah, yes. So again, lower back, start with the lower back, the whole spine, massaging from this position, from that position with a bit of mobilization. Hip down, working on the upper glute, above the greater trochanter. Change the draping, work on the draping really well, and massaging the whole lower leg.
What about a hamstring?
Hamstring, you come and attach from here. Yeah?
Yeah.
Yeah. If you want, you can do nice stretch to the hamstring. Yeah. Work when you stretch. Wait. Work when you stretch again. There's some technique.
Yeah.
Then you can do, maybe I'll show you, after that when you want to do some mobilization, you take that down, yeah? And then to mobilize the hip, what you can do is just bringing it down. So my hand is underneath, I'm holding it. That's a flexion mobilization for the hip. Enough, right?
Yeah.
Let's take about 15 minutes each group. Yeah?
Yeah.